right, we are live and all set to go.
Okay, it's 6 o'clock. I'm going to call the meeting for tonight, the Board of Health, April 12th, 2022. And I'm going to take a roll call first and find out who's here. So I'm Glenn French. We have Dilip Jain.
Present.
Lisa Johnson.
You're muted, Lisa.
Muted.
Yes, I was trying to unmute. I am here. Thank you.
Oh, good. And Swati Singh.
Present.
Good. And Teresa Capobianco will be joining us momentarily. And we have Kristen Black, the health agent, and Katie Holt is recording. Is Katie with us tonight?
I'm here.
Hi, Katie.
Hi.
All right, before we start the, we started the meeting, but before we get into the meat and potatoes, we'll ask Kristen to review chapter 20 of the Acts of 2021 with us, and for those who might be listening.
Okay, thank you, Mr. Chair. This meeting of the Northborough Board of Health is being conducted remotely consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Thank you.
Thank you, Kristen. All right, we're going to skip over the approval of the February 8th, 2022 meeting minutes until following the meeting, at the end of the meeting. Right now, we'll go right into the COVID-19 update.
Great, so I'm going to share my screen and then I will hand this over to Isabella Caruso. And just so everybody, if you haven't had the pleasure of meeting Isabella yet, she is our regional epidemiologist who is hired under the contact tracing grant that was awarded to the Greater Boroughs Partnership for Health, and Northborough is the host. So bear with me a minute, Isabella, I'll cue you up and just ask me when you would like me to advance the slide. So all you, Isabella.
Right now it's like the presenter mode.
Okay, so all right, Jim might have to. Let's see. Does that work?
Perfect. Yes. All right. Hi, everyone. So just going to go over some case counts. So the most recent data is from April 2nd. That is posted through Massachusetts. So it's a 2-week time span. And in that 2 weeks, there was 36 confirmed cases. And just as a reminder, these confirmed cases are lab tests, so either antigen or PCR, but through a lab. So no at-home tests are included in this measure. The 14 average day incidence rate was 19 per 100,000. And the percent positivity rate was 3.74%. So all three of these metrics have increased from the previous 2 weeks. And I did run the data this morning from MAVEN, the Massachusetts surveillance system. And from 3/27 to April 9th, there were 57 confirmed cases. So again, increased a little bit. And this week's Friday dashboard will have updated information on the incidence rates and the percent positivity rates as soon as Massachusetts releases that information. Next slide, please. So this is the graph of the entire pandemic. So starting March 10th, 2020. So as you can see, that big surge was Omicron, and now towards April, we are seeing a little bit of an increase, as I just talked about. Again, it's nowhere near the Omicron surge, but we are just seeing a slight uptick. And the orange dots are just the seven-day moving average, just to help us understand the trends of COVID. And again, these case counts are through Maven, so they are the lab confirmed positive cases. Next slide, please. Okay, so I just wanted to talk a little bit about this because a lot of the limitations for our data right now is really driven through the ability to get a test or the want to get a test. So the MWRA does COVID-19 wastewater data, and they do it in the northern part of Boston and then southern. So as you can see in this little graph, you probably can't read the names, but in the southern part of the MWRA includes Framingham and Ashland. So although they don't go western to Northborough, they are pretty good indicators. And on the left, this graph, so here we are on April 12th, we are definitely seeing an increase. In the last 2 weeks, it has almost doubled to about 500 RNA copies, which is just a measure of COVID-19 cases in the wastewater. So again, this really can see the trends of COVID-19 and is not limited by the amount of tests or the ability to get a test. And next slide, please. Perfect. Thank you so much.
Yeah, so I'm gonna update the board on just our contact tracing and testing efforts. I don't know if there's any questions for Isabella before I move on, specific to really our case counts and monitoring.
I have a question. This is Glenn French. Is there a correlation between the wastewater numbers and the testing numbers? Not so much the dot for dot, but as you see the wastewater numbers detected and we see the testing numbers, do they sort of correlate out together?
I would say so. I would say the proportion and the trends over time are definitely increasing. Obviously, it's easier to see in the wastewater just because that is not based on anything. But in the last 2 weeks, we have seen like a 20 case increase. So again, that doesn't sound crazy, but again, most people we are talking to through this contact tracing are not going to get a PCR. Specifically, if one person in like a 5-person family, one can get a PCR and then they're just going to do the positive antigens. But I would say they're correlated.
Okay.
Isabella, I have a question. This is Dilip Jain. So when they give those numbers out for the number of cases over a 2-week period, do they divide that up into vaccine naive and vaccinated individuals, or what percentage are we looking at? That those 36 or 37 cases are in unvaccinated or partially vaccinated versus fully vaccinated?
That is a great question. I don't know if they separate it out completely. I can definitely look at the vaccination rates and then look at those cases to see if they were vaccinated, and I can report back. As far as I know, Northborough has really high of the first 2 doses. Based on the booster, it was about 40 to 50% last time I looked.
Right. And then the other question, which of course you don't hear it anywhere in the news media, is out of the people who've had the vaccine and have gotten the illness, COVID, how many of those have had the Johnson & Johnson, how many have had Pfizer, and how many have Moderna? And of course, there's politics and money behind all of that. I understand that. But I was wondering if there's any data available on that, which can be extrapolated to, our numbers.
Yeah, I can definitely look and try to see kind of the relationship between COVID cases and vaccine. That's a great question that I can look into.
And
I wonder if you'll
Dr.
ever find it. I wonder if it's ever recorded anywhere.
Yeah.
Well, most of the cases they report their vaccine history, so we could see just the correlation between if they were positive and what vaccine they got or did not get.
Yeah, so we, just to touch upon that, it's the state reports vaccination data, but they don't relate it to recent cases. So you can, filter on the town, the state's dashboard and get down to these levels, similar to what Isabella's reporting here. But it would be a manual exercise, as far as I know at this point, to say, okay, of the last 50 cases, we could manually extrapolate that data through Maven, line list report. It's a lot of effort. We did look at that at times, right? And Northborough's fairly well vaccinated. The problem is as that's downloaded through the Maven system, it's not a perfect match, right? So the state is connecting the immunization MIS system to Maven. And sometimes it works really well. And other times we'll talk to a resident and we're like, oh, it shows that you don't have any vaccinations. They're like, no, I do. It didn't merge because they used their maiden name or their name was misspelled when they were vaccinated. So I don't think it will ever be perfect, but to your question, Dr. Jane, we can look at sort of those trends. I was just on the schools today with a medical advisory team call. They were talking about a recent sort of cluster associated with an event in the Northborough, Southborough schools. And in that case, all of the students and staff were all fully vaccinated. So there's a lot of occurrences where these breakthrough cases are unvaccinated, but even to get down to the level of booster, it doesn't always come across. And we can call residents and ask them to update that, but some residents don't want to give out that information. And so it's difficult to get a complete, a complete picture of what's happening, and definitely not something that the state is making easily available at this time.
Thank you.
Okay. Any other questions for Isabella?
I have no further questions myself. Delete.
All set. Thank you.
Lisa? No.
Having a lot of trouble with my mute and unmute tonight for some reason. Thank you for that. It was really helpful. I don't have any questions.
Thank you. Okay. Oh, well, we'll go on to the Be Well Northborough.
Oh, I'm going to wrap up. Glenn, if you don't mind, I'll just cover
sorry.
contact tracing. A few more slides I'll just cover briefly. A lot of these are the same ones I showed a couple months ago, but I just want to remind you that in Northborough, the health department, through the nursing staff we've contracted with, we are still continuing to make contact tracing calls to any positive residents in town who are reported through Maven, right? We wouldn't know about an at-home antigen, but if you appear, there is one call at least that's placed. We're definitely focusing our efforts on under 18 and over 60. Some residents have been surprised in recent weeks to say, you're still doing this? HIPAA, there was one we heard from, I don't know if this is Isabella Nurse, this is a HIPAA violation. Why are you still calling me? So, the rules around this haven't changed. You know what I mean? I know we've seen isolation, shorten and things like that. It's still up to the local board of health and the health department to reach out and make these calls. So we're continuing to do that in a light manner, just to make sure that they realize there's still rules out there. If they have trouble navigating it, a lot of times there's questions about when can my husband go to work, or, when can my child go back to school, how long they wear the mask. So the nurses are still there. And then just want to remind all residents, whether you test PCR or an at home, or you just have an exposure, we still do have great access to nurses who can answer your questions. So you can call the health department at 508-393-5009, and a nurse will return your call within 24 hours or 24 business hours. And Isabella, with this recent surge, has also been helping our region with some of these calls. So we're still here to answer questions. Free PCR testing. Since we last met, the site in Marlborough and Ashland have closed, but I believe Worcester and Framing is still running, but they may be on reduced hours. So everybody should really go to the state's website. We also have a tiny URL with some of that information. So it's for Northborough, just our town's webpage. It's tinyurl.com/NBorough, NBORO testing. And you can find out about those test sites. Again, residents, we're still encouraging all residents to seek testing if they're symptomatic or exposed to someone with COVID-19. Given it's allergy seasons right now, it's especially important not to assume it's your, allergies in this small surge we're seeing. So free at-home kits, there's been 2 rounds distributed through the federal government. But we also are fortunate because of a Metro West Health Foundation grant. We are sitting on hundreds and hundreds of the iHealth test kits, the same ones a lot of our residents receive through the federal government. And here's a little flyer. This has been pushed out through town news, posted at the library, at the senior center, hopefully on social media, et cetera. So Northborough residents or any employees that work here, not just town hall or municipal employees, but if you work in Northborough or you live in Northborough, we're happy to deliver. You can come by and pick up these free test kits. library has really great hours. That's an easy place for residents to go. The senior center, we're really trying to distribute those during our staff nursing hours or anytime at the health department. So we've had little upticks, but we have plenty of kits, and especially as people are getting ready to gather for, religious holidays coming up and things like that. You might have a lot of people close. Please don't hesitate to come by and pick up the kits. And we're happy to give however many you would need for whatever events or what suits your needs. We're not rationing these at the moment. The good news, when these first were delivered, they have an expiration date printed on them of July 27th, 2022. But this set of kits that was manufactured, that was just extended by 3 months. So these kits are good all the way through October, and we hope to continue to have them available. We'll give them out at town meeting, other events, and we've distributed them through the food bank. We've given them to municipal departments. We're working, we called the affordable housing. They have plenty. We called over to our senior center Meals on Wheels program with BayPath. They have plenty, but we do have them if there's any need in the community. We want to continue to encourage people to take those kits.
That's great.
Okay.
Great. Yep.
I don't know if you have questions on testing or you want me to roll into Be Well Northborough.
I can't wait to hear about Be Well Northborough.
So, okay. And I apologize to the board. I feel like, we've been talking about this a lot in town. You may have heard if you follow the Board of Selectmen or some other boards and committees, but I haven't really presented all too much to all of you. So just so you know, this is a new collaborative across really departments. So we're thinking about the departments we have here in town. It's really, police, fire, recreation, family youth services, Northborough Senior Center, their council on aging, our health department, library, schools. And we're also working obviously with the town administrator's office. So the idea is that we already do a lot of things that have helped us respond to COVID-19. So programs around mental health, social engagement, food insecurity, other things that have sort of the response to COVID-19 and where we are now. So the whole purpose of this Be Well Northborough is really an umbrella. It's really a rebranding of sort of what we do and just putting all of those resources, expanding them and trying to engage the public to access these services and programs and social opportunities to connect under a new community calendar. So on March 14th, we're very grateful the Northborough Board of Selectmen approved $100,000 in ARPA. This is the American Rescue Plan funds to support this new Be Well Northborough initiative. So we're going to have a fancy new simple URL and website. It will be an easy button on the town's webpage that we hope to launch in the next week and a half. But for now, here's the long link. If you go under the COVID-19 page, we sort of have a sub page that's just called Be Well Northborough. And so on that, we do list some of our upcoming events. Some of the things that have already been funded, we're still working out our process for reviewing proposals from, let's say different community groups like the Community Affairs or the Garden Club or other people that have programs that fit under this. The idea is we would really sponsor town departments, nonprofits, et cetera, to do projects that really relate to overall health and wellness in our community. And so one of our big kickoff event I want to make you all aware of, and here's the flyer that's going to be released soon. This kickoff event is the last day of school in Northborough. It's a half day. And so we really want to make a fun event that's really open to all families. It's free of charge. It's paid for with these ARPA funds. And this event is really being led by our recreation department, Allie Lane, who knows how to run events and has been here with the town for a long time. So we are fully going to fill out that park with fun inflatables, but also games for all ages. And we want our seniors or people of any age to really come out and take advantage of this opportunity. There'll be yard games like cornhole, et cetera, but we're going to use this as an opportunity to connect our residents to the programs we already have in town. So imagine that we're going to have tents out there. The health department will be there with our nurses to give out information and free test kits. Youth and family services will be there to talk to people about, the interface referral service. The schools will be present. The libraries will talk about their upcoming programming. So a lot of this, we are adding new programming around mental health, substance use prevention, other topics, really thinking about the COVID-19 response. So mark your calendars for this event. Please note at the bottom, this is not yet released, this flyer. I just wanted to show you what this event is about, but that website's not yet live, but we have purchased that that website, bewellnorthborough.com. So we want to make it really easy for our residents. This is one event, but more to come. So there's already some events like free yoga on Saturday mornings, hikes that have been arranged where people can, again, get outdoors, make new social connections. So you can check out more on the website, reach out to me if you have questions. But other departments are thinking about programming or needs, and I really want to use this opportunity to talk to the Board of Health members to say, are there programs you would like to see that we would seek to use these funds or resources that we'd want to try to connect our residents to? So I'm going to stop my screen share and just see if there's any thoughts or discussion. And hi, Teresa, I just noticed you joined about this Be Well Northborough. If you have questions or you've heard from residents or what you'd like to see.
I personally have nothing to offer at the moment, but it's fantastic. I didn't really know this was going on. So will there be food?
So yes, we're trying to keep that healthy thing. The event's 1 to 4. There was a big discussion of, do we do food trucks and this and that, but we are trying to, a lot of people will have year-end parties and things like that. So we're trying to meet somewhere between kids getting out of school, going to lunch, maybe coming over here. So definitely healthy snacks, free giveaways. We're in the process of the group maybe approving Frisbees, things encouraging physical activity. Yeah. We're hopefully partnering with at least one grocery store we're in contact with to have healthy snacks, water bottles, refilling stations, fruits, staff running a popcorn machine. We'll see what else we come up with. So yeah, Glenn, we'll try to feed them. We'll try to give them some snacks, but not a full dinner affair, not a big food truck event, really just focused on sort of that early afternoon.
Otherwise, we need to get a food permit.
Those are difficult.
Just
it
a question.
Is a slippery slope, isn't it?
With anxiety present in kids, right? Elementary school, and we have 4 of them in the town, plus the private schools. Is some of this are we able to use some of this funding to provide, I don't want to say mental health, but lack of a better term, support for those age groups? Because they have been really affected by this big time. And I'm wondering whether that's a place to, funnel some resources into that area. I mean, I know they have nurses, they have counselors, but you know what, they're already overwhelmed with a lot of things. And I just wondered if that's an opportunity for us to have some impact on our children in the community.
No, I think that's a great point. That's something we've been discussing with the schools. Isabella also worked with Mary Ellen Duggan, our school wellness coordinator, on a recent Metro West Health Foundation grant that was really aimed at providing the schools apply, but trying to get more clinical services in our early elementary and middle schools. Mm-hmm. So more to come on that. We actually were just on a medical advisory team call. Isabella was on that as well, just about an hour ago. And we are working with, you may know, Carrie O'Toole is on that group. So Carrie, I believe she's a Southborough resident, but she has a practice in Westborough and is very well tied in, working with Dr. Medina and the schools and their staff to really look at bringing in third parties to help sort of round out and connect family resources, really targeted at those different age groups. Isabella, can you briefly just touch upon your conversations? You have a meeting with the Resiliency Project.
Yeah, of course. So again, this is something that we have been thinking about and hopefully the grant goes through. But with the schools, I went to a webinar a while back. It was Newton Wellesley Hospital through Mass General Brigham, and it was all geared towards resiliency for parents for dealing with, mental health post-pandemic. So I'm actually meeting with them tomorrow to see if that is something they can offer for Northborough within the region. And that would most likely be a webinar on Zoom. So people can be anonymous, they can ask questions, and it's really just for the parents to understand how to parent during post-pandemic. So I will update as soon as we get information. But again, that medical advisory team is really working towards different programming, flyers, meetings, webinars, coffee hours, anything just to really assist kids, but also the parents, which I think are also struggling at this moment.
So one of our goals that we discussed on the medical advisory team call is to try to get a calendar together, maybe launch it with a forum with different, providers across multiple groups and sort of our youth and family interface referral service, et cetera, to just trying to use different formats to really reach the majority. But also one of the things we're looking to do is, you may be familiar with our community resource guide that was launched at the beginning of the pandemic. It is on our COVID-19 page. That community resource guide was an electronic guide that was done mostly led by our senior center director at the time in partnership with the schools and youth and family. And it's a little outdated now because some of the pages are just about COVID-19 resources that no longer exist. We want to build up that community resource guide to have pages specific to mental health. For example, how to find a therapist, what's the point to start, how do you know when you need one, all those. So we're really trying to cover, there's a lot happening right now across departments. And we're looking at different formats because I think we're very aware, to your point, Dr. J, the needs are very different. Parents need guidance. This is sort of new. And so even youth and family, I just heard today, is partnered with Youth and Family in Southborough. They may be offering mental health first aid, a class that would help both, educate parents to know like the signs of what to look for and how to help children either, as they go. So if you're aware of other programming, Be Well is 100,000. Who's to say if we're not really successful, we couldn't ask for more, but we don't have all of that earmarked. And so if there's a type of program you think, hey, I heard of this in Sudbury and they did this great thing, or, whatever town, I think we want to bring that to the group and try to complement, the program we have, but really expand it to address issues. I think for me, the biggest, issues, it's mental health, it's substance use, prevention, and then also probably just overall health and wellness. I think, more getting back to the days you may remember of Jamie Terry and thinking about childhood obesity and those sort of things as we move through this program into the summer. And those funds, they're ARPA and they're 2-year. So we just started this. So there's no like beginning or end or, all the money has to be spent by July. So also, I just want to keep everybody eyes and ears open. I think the money's still there and it hasn't all been accounted for. And what will happen, we're still figuring out the approval, but the group will look at the proposal and we're working on the metrics now. In what groups is it open? How many could this proposal serve? Is it run by a licensed individual? Do you have references? Is this recommended by, somebody? So we can make sure we're funding things that will really work well in our community.
Information, dissemination.
Mm-hmm.
That's what it's all about. But that's excellent. I like it. And I'm glad we got 2 years to figure this one out. Up to. Hopefully it'll be done with this by then. Okay. Does Lisa have anything to add to this? She's got this background in this kind of stuff.
Taking notes, my first thought was, what are the needs of the community? I just, really want to know specifically, and Kristen already provided that. It's really great to hear that there's more interdepartment connecting happening in town. And one thing that came to mind, I know we're not the most diverse community, but we're becoming more diverse. And does anything with multiculturalism and racism fit in there that we need to be attentive to, or at least keep it on our radar? But I think, that falls under the umbrella of mental health and resiliency. And I don't have any ideas at the moment, but I'll certainly start poking around.
Yeah.
Great. Yeah.
Great. We do have a new
Swati?
Just on Lisa's point, sorry, through chair, we do have a new diversity and inclusion committee at DEI. I don't know the exact name, but that hasn't officially been appointed, but hopefully to your points about multiculturalism, racism, we're really hoping that that group will help make sure that, this Be Well program and other town programs are taking, that into account in the development of all of the programming. So more to come on that.
Great.
Is the Be Well program specifically aimed, driven through the Board of Health? Do they have the lead role in this whole town-wide departmental?
Yeah, I don't think we have a lead. I think, in terms of the key municipal department heads that have been moving things, I've been working very closely with Jen Bruno, if I'm saying her last name, pronouncing correctly, she's our librarian. She's phenomenal. So Jen's been doing a lot of the heavy lifting. And we've been working together. So Jen and I, if we haven't officially, designated chair or co-chair, because it's not a formal committee, it's really a working group, but it's really, but it's been across all departments. And we do have an input form online. So if you go to that Be Well Northborough, there is an input form for members of the public, boards of committees, or anybody to say, hey, I found a great program, send that on over. So we do want to get that feedback and look at it. So it's one of those where everybody deserves credit. The senior center quickly developed programming and have implemented free classes through their department. Rec is already, again, offering some programming with this, but no one department, but the input form is appropriate to use, and you can reach out to any department head really, but the public can.
I think it's great if we could get some information to the public about this program.
Mm-hmm.
And then the input from the public would be really helpful, I think. I think they really, those forms, that's fantastic. So those forms would be, but the public's got to know about the forms, the program itself. So I guess it's a good kickoff coming up at the park. I think it's a good idea. And then if we could get something at the park, letting everybody know about the various, about the forms themselves, I think that's the way to go.
Mm-hmm.
Sort of an informal needs assessment.
Yeah.
Yes. Very good. Can we move on to air sensors at the school? Not quite as exciting, but we'll go with that.
I will share my screen. This will be really brief. I don't have a lot of information. You may have heard before about this. Sorry, bear with me 1 minute. Can you all see this one screen okay here? Is it again a presenter view, or is it okay?
Yep.
It's fine.
Okay.
Good.
So this is just really simple. This is the Mass DP Air Sensor Grant. So I told you about this several months back. We did receive 5 free purple air sensors. Those 4 of them are deployed. So they are at Proctor, Peasley, Z, and Milliken. I'm working with the Algonquin Regional High School, and we'll hopefully get that online soon. I don't know a lot. I haven't had time to dig into this, but for individuals who would like to, and we'll make this presentation available after, there is a long URL to get to the purple air map, and you can see Northborough has our 4 dots here. If you click on each dot, there's additional data there, and I haven't dug into it yet, but there is a FAQ here on what do you do with this data, and what does this mean? Yeah. So it's really through Mass DP, the state wanted sensors, sort of all over the state. We applied, so we are on the map, as is Southborough, and so we should have more information in the coming, months about this information, really where our air quality is. So just want to make you aware of that process is happening and those sensors are being deployed.
Keep our fingers crossed. This could be a disaster. Excellent. Well, you'll update us, I'm sure, about the results of the air sensors. How about the Greater Boroughs Partnership for Health updates?
So I just generically want to speak about the Greater Boroughs Partnership for Health. Our nurse, Erin Shanahan, is out on maternity leave. And so it is now our nursing is contracted. So we're sort of backfilling our contact tracing nurses into our public health excellence. They're continue to work. We have 3 nurses under the public health excellence grant. Jim Frederick is RN, and he is in Westboro for 15 hours a week. We have Celeste Kopek, who is at our senior center for 6 hours a week of blood pressure clinics on Mondays and Wednesdays from 9 to 12. We do have Penny Giacobbe, who is working out of town hall here 2 days a week. She's providing contact tracing services across 3 of our towns. And then we also have Heather Stratton, who's working remotely. But one project I wanted to make you aware of that we're really excited about, cases are picking up, but they had decreased, and we wanted to keep our nurses busy and engaged. So we are working with local fire departments, and we're starting this in Boylston first, where it's almost like a community paramedicine, where we're doing house visits to at-risk residents. who might be frequent flyers with the fire department, just a lot of calls or falls or other things. So we're partnering with the fire department. You may all be aware that fire departments will go into seniors' homes and help them check fire, that the smokes are working and batteries are there and those sort of things. So we're just taking that a step further. It's totally voluntary. We're working with our councils on aging or senior centers and our fire departments to say, do you know any residents who may appreciate a wellness check from a nurse or an LPN who would really go in just to say, do you need help with your medications? How are you storing them? Can I check the bottles? Are they expired? We have pill boxes we've ordered, no skid socks, tape for carpets if there's any like trip hazards. And they're really going into more just to look at the overall picture, and help connect them to resources and just a friendly check. So more to come on that. We're starting that program this week in Boylston, and then we're going to move over to Northborough next, and then hopefully expand with our nurses to offer those sort of wellness checks and really see how that program goes, and if it's well received, if there's a need to return to certain residences, once a month. So we do have per diem nurses through SAM and VNA, and more information coming on that. So that's really the greater boroughs. We are getting close. We're really trying to do all our year-end purchasing, as this is a state grant and all the funds expire on June 30th for this round, which is $350,000. So thank you to Katie Holt, who has been incredible Katie, order this, get this in, because we're ordering for the 4 towns. So we are ordering, we ordered the test kits. We're going to be ordering additional KN95 masks for both adults and children to have those available in case we do have an uptick in the fall, and also surgical masks or the 3-ply masks. So we're really in a building up our supplies. I mean, we just ordered for our senior centers one of those new high-tech electronic pill dispensers where you can sort of program the whole month and the buzzer goes off, and that's really a teaching tool that our nurses who are doing our blood pressure checks will use. So we're really trying to expand our public health nursing with supplies, home visits, et cetera. We're continuing with our vaccination clinics. We offered one on the 8th at the senior center on last Friday, and we vaccinated around, I think the exact count was 235 residents. That was a regional clinic with Northborough, Southborough. In Boylston, it was mostly Northborough residents. We tucked in a few homebound visits, but we do have a follow-up clinic. And again, thanks to Katie and Angie in the office, who have been registering a lot of our seniors over the phone for the last week and a half who have trouble or difficulty registering online. So both Pfizer and Moderna are available. Again, anybody eligible. So over 50 or immunocompromised. The software and those links have been distributed. And I think I sent them through to the Board of Health. So we're continuing using our nurses to keep those programs going, and hopefully more good work to come. We're also working on our budget for next year with the surplus we've had in our nursing line item due to Erin, being on temporary maternity leave. I think Isabella, the group has voted to move forward with making Isabella full-time as she is available as a PhD epidemiology student. She has more availability in the summer. So we're trying to really build up that staffing. I did apply as well for an internship, which is funded through the Mass Department of Public Health. Hopefully that intern would be able to work with Isabella and move some of these initiatives forward a little faster and be a great learning experience for that intern. Lastly, another project that we're working on through Greater Boroughs is a community health assessment. So the big thing is, what do people need? Where are we right now? And we do have some of these resources available. I had a meeting with Metro West Health Foundation. They funded community health assessments in the past for hospitals. So we're looking at different funding options and different third parties that could help us with that. So more information to come. There's a lot of different things we're looking at. We have a great staff, and we're continuing to expand programming, but appreciate your feedback. And anytime the Board of Health wants to come by and meet some of these new staff members, or just, please don't hesitate. Things are moving so quickly. I don't always have the time to update you, but lots of great work happening. And I think that planning for community assessment or community health assessment following that CDC structure is something we're looking to do as a region. It would be implemented locally, but that's another project that we have Isabella working on.
Excellent. Are these 200 vaccinations, are these like boosters, or are these like ones and twos?
Yeah, these were all
Second
second
boosters.
boosters. Yeah, so that was just approved. I believe it was March
Yeah.
19th,
Oh, okay.
if I got that date right. Anyone 50 and over, as long as they're 4 months after their last booster, are now eligible. So you can also go to pharmacies. But a lot of our seniors were vaccinated at the senior center. They wanted to, come back. It's easy. I did hear from a few residents. I was surprised they've struggled or they went for appointments at pharmacies. I've heard, one individual said they ran out of vaccine, another one, the system was down. So at first I thought maybe there isn't a need, but it was very full. We were at max capacity at the
Yeah.
senior center. It was really great to get everybody together. And again, that vaccination clinic was over 50% staffed with medical reserve corps volunteers. So huge volunteer effort. And they've been fabulous in letting us run those. We did hold a very small clinic with the schools on, it was the Tuesday before that. I don't even have my calendar. March is gone. Actually, it was, the 19th, I want to say we had a clinic at the schools, and that was focused on our non-English language learner, right? So English is a second language. So we worked with the staff there, and we did we vaccinated 25 individuals, and a lot of those were first doses. So we really, said to the schools, they were looking at vaccination, saying, what are the barriers? So that was a great clinic. Thanks to Southborough Health Department, they provided an interpreter who spoke Spanish and Portuguese. She helped to register some of these families. So that was our first ever walk-in clinic. We didn't want any barriers. We didn't want people to get confused or get tired of answering all the questions. So they walked through and we were able to do those vaccinations, and we'll have the follow-up 3-week clinic is going to be on April 26th. So actually, that clinic, was April 5th. That was at Algonquin Regional High School cafeteria, and it was really coordinated through the schools, but we supported with helping and worked very closely with Southborough on that clinic. So that was really small scale. So for right now, we're going to do that second booster clinic again at the Northborough Senior Center on the 22nd. Those are our only plans for clinics at the moment.
And all these clinics get posted on the Board of Health website.
Yeah, they're really posted through town news. It's not specific to our website, which is great. Andy Dowd, our town clerk, is great at pushing that out. And I do have a constant contact distribution list. And I believe it was shared on social media, et cetera. So.
And I think you get emails also if you have an account with Northborough Recreation. You do get emails and reminders.
Okay. How long, Kristen, do you anticipate being able to have these vaccine clinics? Like going forward through the rest of the year? Obviously we're only on the 3rd or 4th vaccine booster. First or second booster. And they haven't really gone. I'm just wondering, do we have enough funding to just keep going with these booster vaccine clinics?
Yeah, the good news is our staff force is volunteer for the most part. Okay. And really, there's 2 ways to play for vaccination clinics. We still can get 100% reimbursed through FEMA. And that was extended all the way through July. So all of our costs are covered. Northborough, we are also with the color registration software that the state provided free to all local boards of health. We do have the ability to bill medical insurance. Now, there's no cost to residents. There's no copay associated. But that is likely covering all of our costs in Northborough. So there's really no burden to the town at all, right, financially, other than my staff time, et cetera. The vaccine comes free from the Department of Public Health. So, we're definitely not losing any money. How long do we go? I guess till there's a need and they tell us to stop. DPH is still encouraging us to hold clinics. We'll see if there's a new approval for the under 50 and if there's, just an unmet demand in that category. But I think we'll be planning for the fall. We really want to look to expand our drive-through flu clinic model that we tested for the first time last year. Salmon VNA is ramping up. Last year we did over, I think, 350 doses of flu through that. I wouldn't be surprised this year if it's going to be a flu and COVID-19 drive-through clinic, so we're following that very closely. We want to make it convenient for our residents so they can get it when they need it, and so I think we'll just follow the demands, we heard a lot of calls from the senior center, and that's what prompted us to put together
Yeah.
these clinics. It was the senior center staff kept saying, okay, they're calling, they're asking, can you do it? So
Yeah,
it's, you know, to tell you the truth, they're really fun. It's not a huge demand. We sort of have the system down pat and the supplies. I do have to huge thanks to our MIS, GIS team, David Kane, you know, who always comes through. The hardest part is just getting our vaccinators on the tablets and technology working, because it is a totally paperless system that we run. So the good news is once we're done, there's no paperwork to follow up on. It's all in the system. It goes off to MIS. So it's a pretty efficient system overall.
it's good. And with that, I'm going to segment into the appointment of the medical director. We've been waiting for Attorney Capobianco. He hasn't checked in yet. And
We
this
have her.
is Oh, we do?
She's here. Yeah, she's been here a bit.
Oh, I didn't hear her pipe up.
Oh, yeah, no, I've been here since like
There
12
you are.
past. I'm here.
Welcome.
Thank you.
Sorry about that.
No worries.
So,
Okay, well then we'll get into it.
yeah, so I just to refresh everybody's memory, this was continued from our last regularly scheduled Board of Health meeting. So there were some questions really about insurance coverage. So, you know, just to step back, DPH requires an annual enrollment form for their immunization system. So as a local Board of Health, we can, you know, order vaccine through the state. But in order to do so, we need to have a medical provider who issues the standing orders, you know, and sort of oversees that program. So there's a lot of discussion, you know, and I thank Dr. Jane and Dr. Sane for stepping up, but there was some concerns over anyway, I'll let you speak, Dr. Jane, but just the liability coverage, et cetera. And so really, I think where we landed, and you can all correct me if I'm wrong, Dr. Tennyson, Dr. Joseph Tennyson is he works for UMass. And so just so you all know, the fire department contracts with UMass to provide some services, medical support, including Dr. Tennyson serving in that role. We spoke to Dr. Tennyson, and I believe he is a Northborough resident, but he works with the Marlborough Health Department, et cetera. So there's no conflict of interest there. He is willing to serve in this role. He's helped us when we started our clinics early on, because a lot of this was a partnership with fire. So it's sort of a nice continuation, you know, if it wasn't, you know, to the doctors on the board who wanted to serve in that role. So not to confuse, what's on the agenda is appointment of the medical director specific to the town's vaccination program. And Dr. Sane, you are listed as our ordering provider under our COVID-19 testing program, a little less liability risk because we had gone through that. So we have our lab where we do testing. Dr. Sane is listed as the, you know, ordering or medical provider and helped us get that program up and running. But what we're discussing here is really under the state's immunization program. Who do we officially want to have on the books? And that we would need a formal vote of the Board of Health to designate that medical director under the state's immunization program.
And Dr. Tennyson is on board with the whole thing, I assume.
Yeah, so we corresponded several times back and forth. He didn't want to step on toes. He was lovely. He said,
Right.
if you need me, because it would be a volunteer role. He had checked with UMass, his employer, and he said it wasn't a concern from an insurance standpoint because it was voluntary role. He wouldn't be paid for this, right? It would be separate from his work with the fire department. And we did talk with council, and they didn't think there was any conflict for him serving as a, you know, medical provider under both of the departments in that, you know, in certain capacities.
Does anyone on the board have any comments or concerns?
No, I know Joe. He'll be good.
So we need a motion for this. Anybody else? Okay, we need a motion for this, and I'm looking at the delete. So I'm going to ask you to present the motion.
Okay, I propose Dr. Joseph Tennyson as the medical director for the immunization program for the town of Northborough.
Somebody second that, please.
I seconded.
Bucky seconds it. And I guess now we take a vote. We'll go right through the roll. I'm in favor of it. Teresa,
Yes.
and Lisa.
Yes, in favor.
And Philippe has already made the
Yes.
motion, so we're good to go. Unanimous. Okay, and that's that. Anything else on that, Kristen?
Nope, we should be all set. And it's just
Good.
meeting minutes.
And let's just handle the minutes. And we have the minutes from Tuesday, February 8th, 2022. Does anyone have any additions, or subtractions, or concerns?
No.
No.
No?
No.
Lisa
No, I'm good. Looks good.
and Swati?
I wasn't present at the meeting, but
Oh, yep,
Good.
no, you can't. You don't get to vote. I'm gonna move that we approve the minutes from February 8th, 2022 as recorded. Thank you, Katie Holt. Doing such a fine job. And that's it. Is there anything else, Kristen, we need to know about?
No, so that was a
Fantastic.
formal roll call vote. Are we good? Was that formal enough?
That was a formal enough.
Okay,
unless
we
you wanna
got
go
it. So
through
no,
again.
we're fine. And I think it's any other business before the board?
It's all silent. How's
Just
the
one
food
question.
Inspections going.
Yeah, that's what I was gonna ask you, especially on those two restaurants that have been monitored
Yeah,
since,
it's afraid to ask, but
yeah.
I'll ask for Diane Legier, our health inspector. I know we talked about it before our last meeting. She said things were going well, but I'll follow up that she would forward those reports off to the board, the third party reports. She's been making great progress on really catching up with our food inspections, across all of the different types, working her way down to residential, kitchens to all the rest. So we are doing okay, as far as I know, but I'll look to have those third-party reports on those two establishments forward to the board so you can sort of see it firsthand.
thank
Great.
you.
so is okay like really good, or is okay just?
Well,
you know.
we're sort of, I'm in triage mode with all these projects. So I'm like, you
Yeah,
tell me
yeah.
when we need to close and it's really bad, but I can't say, I know it's not really bad. So I should be more in
Good.
touch, but maybe it would be really helpful at our next regularly scheduled meeting to have Diane come and just give
Yeah.
the board an overall update and really focus that more on food inspections, if you guys would find that useful.
Yeah, I think that's a good idea.
Yeah, hopefully
great
we're moving
idea.
away from COVID and clinics and, we'll have more
Yeah.
Be Well updates most likely, but we'll see. We'll look to have Diane attend and give us some updates overall at just our routine food inspections at that
Yeah,
time.
it's just to monitor the trend to make sure that
Yes.
they're
Mm.
staying at the level, at the top level as top can be, as opposed to starting to slide off because they're not being followed closely enough. You know what I'm saying? Because if they start to fall off the track and the trend is downwards, then maybe we need to rethink or do
Right.
something different.
Well, I gotta say, you guys down the Board of Health have been very busy. You don't know whether you're coming or going down there, I imagine. But it's appreciated.
Doing
So with
great
that in
things for
mind-
our town, Kristen and team.
It's great.
It's terrific. We're very fortunate to have all of
We
you.
are.
Thank you.
I think it's very good.
Welcome.
All
Well,
right,
come-
and I've been
come
here
visit.
a long time. So with that in mind, if anyone has anything else to say, we'll listen to it. Otherwise, I move we adjourn the meeting.
Seconded.
All those in favor?
Aye.
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 And Swati
Aye.
and Lisa. That was
Aye.
Lisa. Swati
Aye.